You need to communicate your wishes to your family members, your friends, your physicians, anyone who has a say in your health care or is really a close person to you in your life, and that's so that they're aware of what you would want. And you also need to be talking to your healthcare agent, which is the person that you'll appoint in your durable power of attorney to speak for you in the event that something would happen. So this person needs to be aware of what your wishes are, and perhaps their wishes may not be what your wishes are. But you need to make sure that that person is willing to support you on your behalf and do what you would like.
If you worry about the medical care you'd receive if you became ill and were unable to speak for yourself, a K-State Research and Extension publication, Advanced Healthcare Planning in Kansas, has the necessary forms to help you state your healthcare preferences before a health crisis occurs. Advanced directives allow you to voice your future healthcare wishes and appoint someone to be your voice if you become unable to speak for yourself. Unless you have these documents in place, however, decisions can be made on your behalf that may not align with the care you want to receive. Unfortunately, more than 3 out of 4 American adults don't have advanced directives in place. On today's Sound Living, the steps that need to be taken now to make sure your future health care meets those expectations. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wickman. Kansas State University Interim Director of the Center on Aging and an Associate Professor and Extension Specialist in Adult Development and Aging in the College of Health and Human Sciences, Erin Yelland, is author of the publication Advanced Healthcare Planning in Kansas. She explains the importance of having advanced directives in place.
As a cognitively healthy adult, you have the right to be informed of your medical care and decide your treatment. But what happens when you become unable to voice your own decisions for yourself, if that's temporarily or permanently incapacitated? And that's where advanced healthcare planning comes in. It allows you to voice your wishes regarding your future healthcare needs in the event that you become unable to do so.
We often think that this is something that elderly people do, but it doesn't necessarily have to be.
Absolutely. Advanced healthcare planning can start when you're 18 years old. And that's really important because accidents and tragedies and events in life can happen at any point. This is not something that is just for the elderly. You can get in a tragic car accident, you could fall off of a tractor or something and leave you temporarily or permanently incapacitated where you're unable to make your own decisions. And that can happen anytime.
They refer to these as advanced directives, and that's really what it is kind of a blueprint for what you would like to have happen?
Exactly. In these, you can name someone who you would like to make decisions for you in the event that you are unable to speak for yourself, but you can also leave what is basically an instruction list to your family and friends that lists what medical care you would like to receive should you become unable to make your own decisions.
As part of this publication, you spend quite a bit of time talking about communication being really a key part of this entire process. Why is that communication so important?
It is absolutely integral to this process, and that's for many reasons. The first of which is that you need to communicate your wishes to your family members, your friends, your physicians, anyone who has a say in your health care or is really a close person to you in your life, and that's so that they're aware of what you would want. And you also need to be talking to your healthcare agent, which is the person that you'll appoint in your durable power of attorney to speak for you in the event that something would happen. So this person needs to be aware of what your wishes are, and perhaps their wishes may not be what your wishes are. But you need to make sure that that person is willing to support you on your behalf and do what you would like.
And for some people, this will be a difficult conversation, one that they may not even know how to begin.
Sure, and we see that a lot with parents wanting to talk to their children about getting their advanced healthcare directives done, but also with children wanting to talk to their aging parents about getting their advanced directives done. And we offer some tips for starting those conversations, and that can be really hard to do, and breaking the ice is often the hardest part. A few things that we like to say that could be your icebreakers are, I need your help with something. Or saying, I need to start thinking about the future. Will you help me? And sort of spin it off on, this is something you're doing for yourself. And then say later on, oh, hey, what are your plans for your advanced healthcare directives? Do you have them? And what are your wishes?
You mentioned durable power of attorney. Let's talk about some of the specifics, I guess, because there are certain forms that have to be filled out in order for these wishes to be carried out.
Sure, and the durable power of attorney is when you're appointing someone to speak on your behalf. Kansas is lovely in that they offer a statute form, which is a fill-in-the-blank form. You can get it from the KSRE bookstore and download it and fill it out. You don't have to have it notarized. It can be witnessed by 2 people, but they're really easy to do. And in this form, you basically state your name and write down the individual that you would like to speak for you, their address and phone number, and then you sign the document yourself and have it witnessed.
So what exactly does this form do?
All it does is give someone the right to speak for you on your behalf should you become temporarily or permanently incapacitated. And they can make multiple decisions for you, including what treatment you would like to have, but also who would be treating you and where you would be treated. And I always like to share the example that if you were in a very small rural town in Kansas that perhaps doesn't have the specialists at the hospital that you would really need, your durable power of attorney has the ability to say, I really think this person needs to go to one of the larger cities, to Wichita or Kansas City, for example, where they can receive more specialized care. So they can say what type of care you're receiving, but also who's giving you the care and where you're receiving it.
I guess another thing they have to consider then is who should be in charge of this. It could be a child, it could be their spouse, but that's another decision that has to be made.
Absolutely, and that's again where communication comes in. So first you need to think to yourself, who would be the best person to represent me? But then you also need to communicate with that person who you think is best and see if they're willing to represent you. This is an instance that comes up in families that have multiple children. Oftentimes there might be hurt feelings if one child is named the agent and the other children are not. So having an open and honest conversation about why the decision was made and why you think it's best can really be beneficial for the whole family.
What exactly is the living will?
So a living will is an instruction list to your family, your friends, and your physician about what type of care you would like to receive at the end of your life. In the statute form, and again, this is a fill-in-the-blank free form that you can fill out that Kansas offers, it is basically saying that you do not want to be on a ventilator and you do not want artificial nutrition and hydration. You don't want life-sustaining procedures. So if a physician deems that you are indeed terminal and you will die no matter what, you are saying that you don't want any life-sustaining procedures in place.
Can you make exceptions? Are there things you can put on the form that say yes in this instance, but no in another instance?
Absolutely, but unfortunately you cannot do that on the Kansas statute fill-in-the-blank form. And that is because the lawyers cannot guarantee that that additional writing that you put on the form will be upheld in a court of law. So if you have specific wishes and your wishes don't exactly align with the fill-in-the-blank form, it's recommended that you consult an attorney.
When then does a living will actually become effective?
A living will only becomes effective once you are deemed terminal by 2 physicians, and this has to be done in writing. One of those has to be your attending physician, the physician who is primarily in charge of your care, but also an additional physician has to say that you are indeed terminal.
In terms of completing these forms, how complicated is that? Is this something that you do online? Do you print them out? How does this all work?
So we have the forms available through K-State Research and Extension. So you can contact your local extension agent. They can download the packet of information for you. And the information in the packet will tell you all about the forms, how to complete them, and it also provides the forms for you. Now, actually filling out the forms is not difficult at all. Most of them require a name, an address, a signature, and some witnesses. They're very easy to understand and very easy to complete. And most of them are 1 or 2 pages long at the most.
And if you're somebody who does this maybe in their 20s, you have some life changes and want to make some alterations to it, what happens there? Do you simply revoke the entire form or do you just make amendments to it? What happens?
So it's very important that you do review your forms. You should review them at least annually to make sure that they still align with your wishes. We're all thinking of new things and perhaps you've changed your mind about something. So it is important that you review it. In order to revoke it, you can simply destroy the form. And in order to do that, you can burn it, you can shred it, you could just throw it away and recycle it. And then what you should do is just complete a new form. Have a brand new form with brand new signatures and all of your wishes identified.
And then we have to make sure that we remove copies from other folks and get them replaced.
Absolutely. So it's very important to keep a log of where copies are held. So if Bob down the street has a copy, you should have it written down that Bob down the street has a copy so that if you do update it, you can then give Bob your new copy and ensure that the old copy that Bob has is destroyed.
I'm assuming that a lot of thought is going to go into this before people jump online or get the forms to fill out. But exactly what would you recommend that they keep in mind as they're going through this entire process?
The first thing is to really think about who would best support you and honor your wishes. And for many people, that might be an easy answer. And then have a conversation with that person and ensure that they will, in fact, support you and carry out your wishes should you become put in a situation where you can't voice your own decisions. So first, start by thinking about it. Who is best to support you? And then think about, with your living will, is this what I want? Do I want to be on a ventilator? Do I want artificial food and nutrition and hydration? These are all things that you just need to start thinking about. And sometimes the answers come pretty quickly and pretty naturally to you.
Once they've got the forms, everything's been completed, the need to store them is very important. What are some ideas you have there?
Well, the first is what not to do. The first what not to do is don't keep it in a safety deposit box in your bank. And that's because if something were to happen to you, there are very few people, if anyone, who has access to that box and can get the documents for you. That is a very inaccessible location. Now, it's important to note that copies are valid. So even if you keep an original in a safety deposit box, for example, if your son is your agent and he comes with a copy, that will be honored. They don't need to show the original. Other than that, it's really important to make sure that your durable power of attorney, your healthcare agent, has a copy of your form. Keep a copy in your car's glove box. Keep a copy on your refrigerator or in a kitchen drawer that's easily accessible. Make sure that your physician has a copy. Your hospital will also keep a copy on file for you. Give it to close friends and family members. Basically anyone who you would think might show up to the hospital if something were to happen to you.
Is there cards you can keep in your wallet or purse, bracelets, or anything like that?
Absolutely. So in this publication, in the very back, we have wallet cards. And you can fill those out with your name, your physician's name, your healthcare agent's name, and also list places where your document is stored. Then if something were to happen to you, an emergency response team comes, one of the first things that they'll do after they have you stabilized is look in your wallet to figure out who you are. Then in there, they'll see these cards and say, hey, this person has a durable power of attorney. We need to contact that person. Or this person has a living will and we need to get a hold of that document.
We were talking about the fact that things change over time. If you move from one state to another, do you need to check to make sure that one form is current or fill out another form?
Absolutely. So the thing with states is that each state has their own individual and unique form, and you cannot always guarantee that another state is going to accept your form. So if you move, it is strongly recommended that you fill out that state's form. Another thing to consider is if you spend a large amount of time in another state. For example, if your children or grandchildren live in a different state and you spend a frequent amount of time there, it's also important that you fill out a form in that state as well, so that you can ensure that your wishes are going to be honored in no matter what state you're in.
That's Kansas State University Interim Director of the Center on Aging and an Associate Professor and Extension Specialist in Adult Development and Aging in the College of Health and Human Sciences, Erin Yelland. The publication, Advanced Healthcare Planning in Kansas, is available online from the Extension Bookstore, bookstore.ksre.ksu.edu. For more information on aging-related issues, contact your county or district extension office or visit the Extension website, www.ksre.ksu.edu. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wickman, and this is the K-State Radio Network.